So welcome to week 2 of motivational interviewing. Today we will move on to the next important concept in this class. Now, of course, in examining the words, we have to understand this comparative mechanism between Greek and Latin in Indo-European languages, between being passionate from the Latin passio and being pathetic from the Greek pathos. So it's really understanding how the word itself shapes the way we are approaching emotions or feelings in general. And from a more neural underpinning of behavior, this is definitely connected with mirror neurons. Now, if instead we talk about warmth is to be interpreted in the context of motivation interviewing as conveying acceptance and positive regard through their own positive affect and body language. Again, this is borrowed from Rogers' approach to therapy. Discussing empathy is extremely important in motivation interviewing. I first like to discuss the general understanding of the word from the perspective of the English language and in the context of practical application in health coaching. And then we'll talk a little more about the etymological and historical components of the word. So generally speaking, empathy is the ability to put oneself in another situation and accurately convey an understanding of their emotional experience without making a judgment about it. So in this context, empathy is different from sympathy, and in comparing the two, empathy is a more egalitarian sharing of a feeling state, and encompasses a wide range of affect, where sympathy is generally a reaction to another's sadness or loss. Integrative health and wellness coaching. It is important to go back to the basics of health coaching in general and understand those 4 pillars, we could say, of the discipline, starting from self-awareness. And this is a concept that is definitely related to what we said last week in regard to Carl Rogers. We have a mindful presence, which is, of course, connected to some meditative disciplines, although it's not necessarily limited to meditation per se or relaxation techniques. The sacred space, which is a term that is connected to a spiritual, some would even say religious approach, but it's not necessarily limited or limiting in this context. Sacred as in separated, that's the etymology of the word. Separate from our everyday life, which has been proven to be somewhat difficult or overwhelming, and that's why very often motivation interviewing is recommended. So sacred as a separate element from this pressure. And finally, authentic communication, because we want to make sure that this patient-provider relationship is built upon trust, openness, and empathy. So let's review this acronym, OARS. O stands for open-ended questions, A stands for affirmations or positive affirmations, R stands for reflections, reflective listening, and S for summaries. So we could examine some of the examples of open-ended questions, and we could start by asking our client or our patients, how are you, for instance? How would you know things were different? What did your life look like previously or before this happened to you? What else? Of course, with what else we could add, what else could you tell me? But that, of course, has some level of authoritative direction that we want to avoid as much as possible within motivational interviewing. Other example would be like, what would your life look like if you were successful in making these changes? Other examples are, how would you like your life to be? How did you feel about that issue, that problem, that change? How do you feel about them? How do you think your friends or family or co-workers help or hinder your progress? And how's that working out for you? Maybe this one is one of the most important ones because it really provides some basis on what is empirically valid, we could say was experiential, what is even within a clinical psychology context not a cognitive distortion, so something that is reality-based, regardless of what the client might say in terms of what their preference are. How is that working out for you? And again, this is not confrontational in any way, it's not directed in any way, but it's really focusing on what is actually happening now in order to provide a better grasp on which stages of change we should start with. And of course, there is more. We could say, what are your options once you explain different ways to approach that problem? By explaining, I mean, focusing on what the client just shared with you. You can ask somewhat directed question, but still phrase it an open-ended question, such as, what would you like to do now? What did you first think about being involved in that? How can this program support you? What was that like? Each of these questions require a non-binary answer, which is exactly what we're trying to do in motivational interviewing. As we said, proceed with cautions. There are some tell me more statements that we could use here and there, although technically speaking, those are not necessarily phrased as open-ended questions, but more of a request, a direct request, that is. Something very, very broad could be, tell me more about this, tell me about your goals in your life, your values, tell me about what you think about this issue, this problem, tell me about a time in your life when you were blank successful, for instance. Tell me more about when this first began, whether it's positive or negative. Tell me about your overall experience with your health condition. Tell me about the time when you felt good about how well you were doing, and so on. Now that we examined some of the most important founding concepts within motivational interviewing, we will move on to next week's class by digging a little deeper into the practical application of such skills. Thank you very much, and I will see you next week.